Hello and welcome to our video guide on pancreas transplant procedure. In this video, we will explain this life-saving procedure in a simple terms for everyone to understand. Why do people get pancreas transplant? Candidates for pancreas transplantation generally have type 1 diabetes, usually along with severe complications like kidney damage, nerve damage, eye problem, or another complications of the disease. Usually, healthcare providers consider a transplant for someone whose diabetes is out of control even with the medical treatments. The procedure. A pancreas treatment is a surgical procedure where a healthy pancreas is transplanted into a person whose pancreas is no longer functional properly. Although it is possible for a living donor to donate a pancreas segment, still, most pancreas transplants involve a whole organ from a deceased donor. After the donor pancreas is removed, preserved and packed for the transport, it must be transplanted into the recipient within 12 to 15 hours. Pancreas transplantation can significantly improve the quality of life for individuals with type 1 diabetes. But it is a complex procedure for potential risks and lifelong commitments to the medications and monitoring. The success of a transplant depends on the various factors like donor-recipient matching, surgical techniques and post-transplant care. Let us understand a bit more about this procedure in a simple way. Candidates for pancreas transplant undergo a thorough evaluation to ensure they are suitable candidates for the procedure. This involves medical, psychological, and social assessments. The donor pancreas must be compatible with the recipient's blood type to reduce risk of rejection. Deceased donor. In most cases, the pancreas come from a deceased donor. The donor may be a person who has experienced brain death but still has viable organs. Living donor. In some cases, a segment of the pancreas may be obtained from a living donor, usually a family member. Surgical procedure. Anesthesia. The recipient is placed under general anesthesia to ensure they are unconscious and feel no pain during the procedure. Incision. A surgical incision is made in the recipient's abdomen to access the blood vessels and organ. The surgeon places the donor pancreas and a small portion of donor's small intestine into recipient's lower abdomen. The donor intestine is attached to the either recipient's small intestine or bladder. Removal of diseased pancreas. In some cases, the recipient's diseased pancreas may be left in place, especially if it is not causing additional health problems. Vascular and ductal connection. The blood vessels and the ducts of the donor pancreas are connected to the recipient's blood vessels and intestine. This is a critical step to ensure proper blood supply and drainage of pancreatic secretions. The new kidney's ureter, the tube that leaks the kidney to the bladder, will be connected to the bladder. Unless recipient's own kidneys are causing complications such as high blood pressure or infection, they are left in place. Closure. After the connections are made, the surgical team closes the incision and the patient is taken to the recovery room. The surgical team monitors your heart rate, blood pressure and blood oxygen throughout the procedure. Pancreas transplant surgery usually lasts for about 3 to 6 hours, depending on whether you are having a pancreas transplant alone or kidney and pancreas transplant at the same time. Post-transplant care. Recipients must take immunosuppressive medications for the rest of their lives to prevent the immune system from attacking her and rejecting the transplanted pancreas. Close monitoring is essential to detect and address any signs of rejection or complications. The recipients typically spend several days to a week in a hospital recovering from the surgery. Regular follow-up appointments are scheduled to monitor the pancreas function and adjust medications as needed. Risks and complications. The body's immune system may recognize the transplanted pancreas as a foreign and attempt to reject it. Immunosuppressive medications are prescribed to minimize this risk. The use of immunosuppressive drugs can increase the risk of infections. Surgical complications such as bleeding and clotting can occur. While the transplant can alleviate diabetes, it may introduce new challenges and diabetes management remains crucial. Thank you for watching our video. Complex Treatments shares such complex treatments into easily understandable language for you. For more videos, please subscribe and like our channel. Thank you.